Thank you very much for joining our webinar today under the title of Innovation and Sustainability in Japan's Healthcare System, Priorities for Investment and Reform. My name is Naka Kondo. I would be the moderator for you during the webinar. Now, when it comes to the life science sector in Japan, Japan has been putting utmost effort in that field. However, there seems to be some risk in terms of Japan lagging behind from the other countries. The COVID-19 pandemic had put under tremendous risk and threat to all different countries. Therefore, today we would like to look at how Japan would be able to rehabilitate towards a bright future. And we would like to have the great panelists here with us and discuss about that very topic. Today's webinar is going to focus on supporting an innovative life science ecosystem in Japan. And at the same time, we have the two reports, which is also talking about the sustainability of the Japanese health system. And based on that report, we would like to have Rohin Omkar, who is going to give us the presentation today. Now, the Economist Intelligence Unit website will contain those materials if you wish to have later. And we have the greatest support from Pfizer. Unless we have them, we were not able to host this webinar. So let me use this opportunity to send my heartfelt gratitude. And also, I would like to thank all the speakers who have kindly dedicated time to be with us today. Now, with that, I would like to once again thank all the audience sparing your very busy schedule out to join this webinar. We have already received and in advance questions a lot already. Therefore, we would like to pose these questions to the speakers as we go through the panel discussion. Now, there has been an impact of COVID-19. Therefore, we are hosting this through an online system. But I would hope that there will be a lot of discussions even after this webinar to continue amongst you. Now, with that, the Economist Intelligence Unit, the Senior Associate, Amka, is going to talk under the presentation on supporting an innovative life sciences ecosystem in Japan. The entire webinar today is going to be conducted in simultaneous interpretation, both English and Japanese. Rohini is going to speak in English. If you wish to listen to Japanese, please mute English and choose Japanese language. And for the panel discussion, that will be discussed in Japanese. And if you wish to listen to that in English, then I would like you to mute the main language and then choose the sub-language of English channel to listen to English. Now the floor is yours, Rohini. Rohini, thank you very much for the presentation. And we also have a great speaker today. And I think that we would be able to talk about building an ecosystem which is innovative. So let me now introduce to you our speakers. From the Shonan Health Innovation Park, we have Dr. Toshio Fujimoto, who's the General Manager from the Shonan Health Innovation Park. And we have Mr. Inamura Takuma, who's the Director and Healthcare Industries Divisions of Ministry of Economy, Trade and Industry, Government of Japan. And we also have Ms. Yukiko Sakai, who's a partner of McKinsey & Company. There's a bio on the website, so please do check that. Now, thank you all very much for joining. And we would like to talk about various areas that would require investments, as well as the corporate environment. And we also would like to look at the impact of COVID-19. So now, first off, I would like to ask the question to you, Mr. Inamura, if you think of regulation, namely from the life science innovation promotion, what are the strengths of Japan that Japan can take pride to the world? And also, if there's any improvement areas that Japan should look into, I would like you to point that out as well. Please. Thank you. My name is Inamura. I'm from Ministry of Economy, Trade and Industry. Now, when it comes to the strength of life science, and also there are some weak area that needs improvement, there's twofold. Now, back in 2012, Dr. Yamanaka have used the iPS cells and has become a Nobel laureate. And I think that this has been one of the major epoch-making situation for Japan. From that sense, the R&D, especially in the regenerative area, has been one of the leading area the Japan government has been putting their efforts in. And also, there are respective system as well. For example, in order to make sure that this regenerative medicine would be able to be progressed, the system had to change. Therefore, Japanese government had started to revisit on how we would be able to make that something that would be leading around the world. One of the another important factor to note is the Japanese government has set forth the office to be responsible for healthcare, and the respective ministries are now collaborating together. In the past, it was done in a silo form, but then when it comes to the basic research and also the clinical research, and all those areas in the past has been done separately. But now we're trying to bundle this all together to be done all together. And therefore, the first term would be 2015 to 2019, and we are in the second phase now. And during that process, we would be able to establish the system and the regulations that would promote the life science as one of the strengths of Japan. And this is something that we are doing. On the other side, when it comes to life science, many countries are putting a strategic investment in this field. Therefore, we also would like to keep in mind of their movements as well. And also we have to keep in mind of the COVID pandemic that we are faced with, so that we have to do whatever possible to be able to put us in the forefront. Thank you very much for that. Now, according to our survey, when it comes to the innovation related to life sciences concerned, there are competing countries such as China as well as Korea, and they are speeding up to catch up with us. So now, keeping that landscape in place, what should Japan do? And I would like to now ask Ms. Sakai to give us your view. Now, when it comes to China and Korea catching up, if the question is asked as to whether that's a problem or not, then in that case, what I can say is when it comes to life science, Japan has been setting as a forerunner in this area. Therefore, the neighboring countries catching up with us is indeed a problem. But how could we be able to solve that problem? As was in the report, when it comes to the public and private areas, we would need to further push that forward, especially from the life science perspective, and all those have to be done all together. Another area that I deem it to be very important is that when it comes to life science, it was more to do with the low molecule compound, but then it has become more and more complex. For example, there's a lot of AI that's coming into this picture. Therefore, the content of research has been changing as we speak. And also, it seems like this research is something different from working in a minute area, but rather it has expanded into a bigger picture perspective. So from that sense, I think we can revitalize and use the capabilities of female workers. And at the same time, we have to work on how we can acquire a foreign workforce as well. One of the example I can cite here is Singapore. When it comes to the R&D workforce, they have a lot of regulatory lifts in order to entice people to come into their countries. When it comes to Japan, there's also a language barrier as well. And so, depending on the field of research, sometimes the language has become the barrier. So that would also has to change to enhance the promotion of the foreign workers. And another thing that's related to the ecosystem is that for this particular innovation, the value would have to be provided. And this has to do with the medical expenditure as well. But I think that we need to keep in mind of the risk sharing as well, so that the highly innovative things would be able to be captured with the appropriate system in place. Looking at the situation recently, there are a lot of pricing that's been done in United States that came into Japan. So within the expenditures of the medicals here in Japan, we have to think of how we're going to handle those spending in place so that the necessary investment can be made in an appropriate area. Thank you very much. I also would like to ask Mr. Fujimoto as well. You know, Japan is being caught up from the neighboring countries. So I would like to hear your take on this. Well, thanks for the opportunity. Now, looking at the neighboring Asian countries, they are indeed expanding the market in terms of healthcare related. I would say that's also good sign as well. Rather than a simple competition, I think that we can work together and be able to expand the entire biofield. But as Ms. Sakai had mentioned, in comparison to other countries, when it comes to nurturing the R&D capable individuals, and investment in this field is declining as we speak. So that is rather more of a problem for us. Because if we were to promote innovation, we have to nurture these new people and need more investment there so that with various mixture in place, the innovation can be born. So it's important that the people would be able to communicate within the ecosystem, and that's how the innovation will occur. So I would say first and foremost importance would be the long-term view in terms of nurturing these capable people. Thank you very much for your view. You have also pointed out that this is one of the area that would require more investment, especially relative to R&D. Now, the second topic I would like to talk about is the area of the investment going forward. Now, I would like to once again ask Mr. Inamura, the government's expenditure towards basic research, what exactly do you think it would become important in the future? Now, from the Ministry of Infrastructure and Economy, we would say that not only the R&D per se, but we are trying to invest in the basic research as a whole. And if that's been done appropriately, then of course it's going to lead the overall area. But I think that the government is still weak in that area. It's not just increasing the public spending, but rather in order for creation of innovation, I think that nurturing the domestic individuals and also bring the capable individual from outside of Japan should also be considered at the same time. Because a simple increase of the public spending is not going to work here. Now, GDP of over 200% or so, how could Japan be able to expand that? And that would be the key. And in order to make it sustainable, we have to think what kind of regulations that needs to be lifted versus put in place. In some cases, we have to bring in the investment from outside of Japan. And there are some potential market in Asia that we can foresee to grow. So having the system in place in one hand, so that the data that would require for the R&D to be done in an efficient manner, and that's important from a system perspective. And I think that that would be the government's role to play. Well, thank you very much. When it comes to the government's investment, I would assume that the perspective would vary depending on where you are. Now, Mr. Fujimoto, as you are directly related to this field, is there any particular example that you can share with us related to this topic? Well, thank you for that. Now, when it comes to promoting innovation, I would say there would be an invention and innovation, and the two has to be separated clearly. Oftentimes, invention is more from a genius perspective, but innovation is a teamwork. And that can be said for the basic research as well. There is a genius person who would always do the inventions, and then the rest would put their utmost effort as a teamwork in order to create that into an innovation. So innovation would be required by collaboration of various people, because that indeed is building industry. So innovation is a must in order to bring that to flourish. So we should not be too short-sighted here. What I always ask the government to do is that we should not neglect the invention. And we should always have to have a longer perspective in order to bring that invention into an innovation. But on the other hand, there's always a limitation of the government's budget. So we cannot just 100% rely on government here. So we should also attract the global community so that the necessary individuals and the professional experts would be able to be drawn in to Japan so that they can help us with innovation. Because this is not something that should be done in the closed door environment, but we should open ourselves up so that we can bring new perspectives from outside of Japan. And that's what we're trying to do. And also, when it comes to the investments that are required from a policy perspective, one thing that I can talk about from an innovation field is that there has to be a long-term innovation from the government. And this was, I think, Mr. Inamura had also mentioned, because IPS is something that actually started to take off here in Japan, because this is the regeneration medicine we're talking about. But there is a huge gap still in order to bring that into the supply chain, because we have to have the support from all the players there. For example, we need to have some sort of catapult in UK, all the way from development to launch to the market. There has to be a flow there. Otherwise, we're just talking about the rosy picture of our future. So it is important that we have the roadmap in place in order to bring that kind of innovation into an industry-based market product. Thank you very much. And I would have to ask another question to you, Mr. Fujimoto. In the report, we also have taken this topic up, which has to do with the career choices of the researchers who's in life science field. From that sense, I was wondering how Japan should work on increasing the number of R&D capable people. Well, in the report, I actually talked about a lot of things, actually. Can you hear me, by the way? Well, when it comes to the researchers, for example, in US or Europe, they have a vast options for the researchers. In case of Japan, let's say for the junior high school students or high school students, if we ask the question as to whether they want to be a researcher, I think the only picture that they can imagine is an individual wearing a white gown, just doing the lab kind of testing. But then, in case of US or Europe, there are a lot of researchers who actually joins the corporate sector and then work with their group and try to develop products. Or in some cases, they become an entrepreneur and then create a biotech company. Or some of the researchers join the governmental institutions and then support in building the policies that the government would put in place. So there are a lot of options there. So we first need to increase the number of people who can work as a researcher. Plus, we need to have multiple options for these people as well, because by doing so, people can learn from different industries and then be able to look at from various perspectives. And that's occurring in US and Europe. The researchers are indeed becoming an entrepreneurs. And by doing so, the industry as a whole could be activated. So why the risk money does not flow in Japan? And I think one of the cause there has to do with no scientists within the venture capitalists. In case of US, there are a lot of scientists in the venture capitalist group, and they know the science, and with that knowledge, they take risks. So it's important that the person has the knowledge of science in order for the person to take the risk. So that's what we lack here in Japan. So we should increase the number of options for the scientists here in Japan, because that sounds as if that's going like a detour, but that actually is a shortcut for us. Well, thank you for that. Now, you talked about the venture capitalist. And now we would like to move on to the next topic, which has to do with the corporate environments. In the report, the new medicine has been approved by the FDA, and those new medicine is actually developed by a small group companies. But in Japan, the large mega companies are the only one who develops the new medicines. So it seems like the startup firms, especially in the bio field, seems to be quite weak here in Japan. So keeping that in mind, how could the support be able to be done to the startups, and how the incentives should be put in place in order to promote such startups to occur? Can you elaborate on that, Ms. Sakai? Thank you. This is actually related to Mr. Fujimoto's comment. When it comes to venture capital, or especially looking at it from an investor's perspective, what becomes important is that the exit strategy. If there is an idea, people who invest in that would need to know how would that investment be returned back to them. And at the same time, as a startup, whether the group has a necessary capable experts in place or not. Well, this is not only the case for the life science related field, it is also be the case for the other venture capital as well, especially when it comes to the exit strategy. For example, pricing. In case of life science, the pricing is one of the uncertainty in a way. And so even if the person is courageous enough to do the startup, that sometimes does not attract the venture capitalist. So that's going to be that's the issue here. And also the team of the venture capitalist. Fujimoto-san had mentioned that the career options here in Japan is quite limited. And personally speaking, I myself actually studied biology, but actually I didn't pursue that and joined McKinsey after all. But like you said, I was actually choosing biology as a major. And when I was in that time, I could not see any career path. So I think it is true, like you said, there is a very few career opportunity for those people. And also, when it comes to venture capitalists, you have to have insight in order to value that particular new technology. And I think that many people may wonder how to view that and to make that into a commercialization. So the private sector's venture capitalists, I think, would have to have that answer for that particular mission. So commercialization and the science, and think the person would have to have both minds together. So I think the nurturing such individual would be quite important, not only science, but I think that it's important that the person would also have the commercial mindset as well. And I think that is needed when the students are at the university age. Well, thank you very much for those words as well. Now, Mr. Inamura, when it comes to incentivizing startups or promoting startups, what's your view on that? Now, when it comes to life science, I think that when it comes to the startup, especially in comparison to US and Europe, Japan is far less. That's an issue on its own. And also, as Fujimoto-san had mentioned, there's some cultural aspect as well. For example, the researchers researching at a university, and if the person want to do a startup there, is there an investors there? And I think matching that up is one of the issue that Japan is faced with. 20 some years ago, I graduated the School of Law and I actually joined a ministry. So I myself was somewhat far away from science. However, when I look at the young subordinates of mine, they always say that their friends have started this startup companies, and it seems like young people do have more choices than the time I grew up. And so whenever I talk to the people who did the startup, the person had a doctorate degree, and this person actually performed as a doctor and then at the same time did the startup. And I also found some people from McKinsey as well, like Ms. Sakai. So I see some role models appearing here and there. When it comes to the world of medicine, the person has to have the license, and even if the person fails in startups, the person would still be able to live their life performing as a doctor. And I think this kind of mindset, I think, is not full-fledged here in Japan. So in the world of healthcare, say supporting the healthcare sector, there are several initiatives that we have. From 6 years ago or so, we are conducting the business contest, meaning that this is a competition amongst the business people and award the great ideas there and support that winner. And also, we conducted so-called innovation hub as well. People who wish to do a startup but doesn't know how, then that hub would provide the knowledge for these people. For there's one from our ministry, but there's one from the Ministry of Labor as well. So the government is in a way supporting that. But I'm hoping that there will be more and more people who want to challenge that, I want the students, even from the university years, that don't fear to fail, but to try. Thank you for that. I think, Mr. Fujimoto, I'm sure you have seen various ventures. Recently, have you seen any changes or any differences that you see recently occurring? If you have any examples, then we would like to hear. Well, like the two other panelists have mentioned, I think that the environment has changed dramatically. So I think that many people have started to know that there are some one career path being an entrepreneur. And sometimes I would receive such kind of words from the students. But in Japan, historically, I think that the companies actually have held the very good researchers. But these days, the area or the field has become quite limited. And so even if the person, the researcher, him or herself, has a vast knowledge, sometimes they can only do a certain things within a corporate environment. So maybe the researchers that the companies have currently may become the great performer going forward, because this Takeda has had a great asset in place, and the person who used to work in that company had spun off, left the company, and did a big startup. And the investors actually valued that initiative and has gained a lot of investments into that business. So it's not only Takeda, but I'm hoping that this kind of situation would occur in various other companies. Because depending on various changes and transformations of the environments, I think there would be a new career path for those people. Well, thank you very much for that. Now, lastly, I would like to now switch the gear and talk a little bit about the impact of COVID-19. Again, Mr. Fujimoto, I would like to have your views, but was there any impact of the COVID-19 on life science? For example, is there any new findings as a result from COVID-19 pandemic? Now, this COVID-19 pandemic actually has brought a lot of changes, not only here in Japan, but around the world. And I think many people have recognized that healthcare is indeed quite important. And I think that many people have started to realize that innovation is important under this COVID-19 situation. And I think that there has been no other situations in the past that everyone is focusing on the new development from the life science area. People are awaiting to have the vaccination of this COVID-19 to come. So one thing that we come to notice is that our health is related to the health of the population around the world, because one infection occurred in one country has traveled so quickly to around the world, impacting so many people. I think no one really thought of that chain effect to occur. And I think that COVID-19 was the first scenario in which we have realized how world is interconnected deeply. And many countries are trying to bring in various measures in order to tackle the COVID-19 situations. And I think that there are all kinds of players that are putting their utmost effort in order to overcome this COVID situation. I think this situation never really occurred in the past. And I think that people have gotten realize that our health matters to the health of all people around the world. For example, we are relying on the vaccination to a different country, and this is also surfaced as we are struggling to overcome the COVID-19. And I think that this is giving the opportunity to further enhance the investment. So the world is now smaller. On the other hand, I think the good thing is that people are collaborating. And one thing is that we should not be reliant too much on one country. Thank you very much. Can you also give us your comment, Ms. Sakai? Yes, like Mr. Fujimoto had mentioned, this pandemic occurred in this globalized environment. And I think that the upside and downside all has become surfaced. In the world of life science, as Fujimoto-san had mentioned, supply chain it has become quite critical for Japan. For example, what Japan should stockpile in case of emergencies. And I think all those have surfaced. For example, the medical devices or medicines that may not have shed light in the past, but all of a sudden, those are the things that have started to shed light because of the COVID-19. Not only the production capability of supply chain, but I think this can also be said at the development field as well. For example, vaccines. Not only for COVID-19 vaccines, I think that there has to be a capability within Japan as to how to create those vaccines or new medicines for the unknown disease to come. And I think that government is putting a lot of budget for this development field. And during that process, I think that selection and concentration might become quite important. We are indeed in a pandemic, and there will be new infections to come in the future, meaning that the basic research is important, but at the same time, we have to keep in mind of how fast we would be able to commercialize that development. So there are things that we can rely outside of Japan, versus there are things that we have to have domestically. So I think that the contrast between that two-sided element would have to be thought out. And I think that people who's engaged in the research should be able to collaborate together in order to tackle that problem. And I think that has become quite prevalent under COVID-19. Thank you very much for your views. Now, lastly, Mr. Inamura, how do you see the situation post-COVID? What's the direction that Japan should be aiming towards to? Can you give us your views? Now, we have learned a few things from COVID pandemic. And I think that some of this has to do with the things that used to be a problem in the past. And we have realized that we have to put a lot of effort in order to overcome and find the solutions to such long-lasting issues. For example, we talked about startups. And one of the challenges there had to do with not having the sufficient environment, and also the entrepreneurs do not have the mindset of doing new businesses. But these days, people who want to do new businesses have a passion wanting to change the things today. And during this COVID, for example, we're talking about the new vaccine or new development of medicines. We are able to do this, then people would be able to know that such development would be able to help people around the world. So young people would now be able to see what has to be done in order to become viable for the future. So I'm hoping that these young people would become more and more entrepreneur-oriented using their passions. And government would have to be able to support that. We're actually supporting the young people in different parts of the world. But I think that we would now be able to solidify that for the people here in Japan as well. And I think that we should not just find the solution to the COVID-19 and that's the end of the story. But rather, I think there are a lot of things that we've learned that can be utilized for our future. And and also utilization of the data is also important. For example, in case of China, government is actually owning a certain data. And it seems like the citizens are actually acknowledging that, meaning that the government would be able to trace individuals because of them holding data. And we also have to think of utilization of data. For example, we are not managing people with the citizens' licenses. And I think that there are a lot of things that we would be able to do going forward. And we now know that there are things that we have lagged behind, especially with the COVID situations. So the digital data reuse is something that we would have to do. And I think that this gives us the opportunity for us to further push this forward. And so there are a lot of things that we've learned. And in comparison to outside of the world, what should Japan do? And that has to be the perspective that the government would have to keep in mind, and the respective ministry to develop the policies. Well, thank you very much for that. Traditionally, when it comes to life science, Japan has been putting a lot of efforts there. But then when it comes to the innovation doesn't occur all of a sudden, not knowing where it is. And I think that there are a lot of areas that has to be improved in order to nurture and respect those innovations. And I'm hoping that this kind of discussions to continuously occur outside of this webinar as well. So Mr. Fujimoto, Mr. Inamura, and Ms. Sakai, thank you once again very much for your time despite your busy schedule. And also for the audience, we are going to take a break here, and then from 3:30, we're going to start the next session, which has to do with the sustainability of the Japan's healthcare system. And we would like to also refer to you on the report there and also the panel discussion under that topic. So I would like to have your continuous participation. Thank you very much. Rohini, thank you very much for your presentation. Now, we would like to conduct the panel discussion for the priorities for a sustainable health system in Japan. Let me introduce the panelists. First, member of the House of Councilors, Ms. Tamayo Marukawa, and also Dr. Hiroyuki Sakamaki, the professor of the Graduate School of Health Innovation, Kanagawa Prefectural University of Health and Welfare, and Mr. Hiroshi Yamanaka, director of Sanno Medical Center. Thank you all very much for joining. Now, the discussion that we're having today is first and foremost, what should Japan need in terms of policy for a sustainable health system? And also, when it comes to the primary healthcare, I would like to look at the structural challenge there. And then at the end, we would like to discuss regarding the drug pricing. Now, starting from the first topic, starting from you, Ms. Marukawa, I would like to ask you a question. In order to promote the innovation, how could you be able to establish a sound financial system? Thank you. Now, first and foremost, I would like to talk a little bit about the innovation budget in Japan. Now, it starts from the drug development and space. It accounts for 1% of GDP. It was 4.6 trillion for year 2020. Usually, the budget is almost in the neighborhood of 5 trillion that would be spent on innovation. In terms of the content of this, like MITI and MEXT and all those ministries are engaged. Every 5 years, we would evaluate the health system, and we are now in the second phase of this overall scheme. Based on this strategy, 12.70 billion yen is actually spent on the strategy of the health system. Globally, this amount may not be suffice. However, talking about here in Japan, the medical health system is deemed to be one of the important area Therefore, this strategy was put in place for 6 major areas in order to have the people understand. One is the medicine, which is 45 billion. And then the second area would be health and also medical system and also genome. This is one of the area I'm also putting my utmost effort in. When it comes to the basic research for diseases, for example, the life-related diseases, there are 5 different illnesses that we target. And also, there are some seeds area that we invest in. One is like bioinformaticians. We feel that there is a lack of such talent here in Japan. Therefore, this amount of money is spent to support academia so that these people and the talent can be nurtured for the future of Japan. So this amounts for about 45 billion yen, but we have 16 billion for, say, biosimilars. And this amounts to about 9 billion or so. This is not ample amount of budget, but I would say that this similar area is one of the areas that is deemed to grow down the road in the future. So academia as well as the private sector, the government would be able to play a bridging role to play so that the biologics would be able to be enhanced going forward. When it comes to biologics, this is, on the other hand, quite expensive. So it would require tremendous amount of money for development. So not just for the pharma alone, it's quite difficult for those private sector to spend their money for the further development of the biologics. So we are supporting that initiative. Second, when it comes to the drug pricing, although we are doing this in an utmost effort, there are some biosimilars that we have to look into. For example, there is a certain injections that people would be able to do at home. So for that kind of the use of injections, it's about 1,500 yen per injection per month. In Japan, as all you may know, we are facing a super aging society. In 2042, the assumption tells us that this would be the peak year for the elder population. It's 22 years from now. And more than 65 years of age, there would be 1.35 million people that would grow going forward. On the other hand, when it comes to the working age people, which is 15 to 64 years old, there would be a reduction of this age group by 16 million people. These are the people who should be working and paying for the healthcare budget. However, the number of the elder people would outgrow the number of the working age population here in Japan. And our consumption tax is still 10%. So I think that there's still a room for us to increase the amount of the consumption tax. But of course, we just cannot arbitrarily increase this number because we don't have enough budget. We would have to be very skillful in terms of deciding which timing and at what percentage we should be increasing the consumption tax. And also, we would have to value the biosimilars as well, and at the same time achieve a certain stable level of the drug pricing that would benefit the population here in Japan. So such balance would have to become quite important going forward. Thank you very much for that. Now, Dr. Yamanaka, can you also share with us of your views as you work in the forefront of the medical center? How should we be able to bring our system in a sound manner? Thank you very much. Now, I myself is a clinician, and so I would have to stand for the clinical perspective. I am not well versed in the policy side of it. Therefore, I would like to especially focus on the clinical side. As Ms. Marukawa had already mentioned, when it comes to the biologics, I am in the position to prescribe those medicines. Especially in the last 15 years or so, I would say that there are a lot of biologics that has been developed. And I would say that this helping patients to make their situations better. But at the same time, as Ms. Marukawa had mentioned, this required a lot of medical spending. And also, there are more and more expensive medicines as well, which is hindering the overall medical spending by the central government. Now, if you think a little bit about what diseases are, there aren't many diseases that you can fully be cured with. The actual infectious diseases and also injuries are the only ones you would be able to cure fully. However, if some diseases that comes from your inside of your body, it's quite difficult to fully cure. For example, rheumatism. This is something that is very difficult to fully be cured. Therefore, people have to take medicine for quite a long time, which has been affecting the medical spending economy of the central government. And in the last 20 years, depending on a certain diseases, we were able to identify the molecules that are acting badly in people's bodies. And therefore, the development of the drugs are now targeting such molecules, which as a result, requiring more and more money. Therefore, in the future, if we think of true sense of innovation, I think that this would have to be put into the preventive medicine area and complete cure of diseases. I am hoping that the research and development should focus more on curing the diseases. If it's just making the situation better, then naturally people would have to rely on medicines for quite a long time, meaning it's going to impact the financial economy of the medical spending. Therefore, I would like the investment to be put in place to fully cure and also in the preventive medicine area. If this become more and more popular, then I think that this would, at the end of the day, work better for less spending on the medical budget. This may be a rosy picture I'm talking about, but I think that this is the area that has to be spent more in terms of investment. And I think that this cannot be done alone by the private sector. Therefore, I would like to urge the government to support the private sector from the true sense of innovation. So please do invest in this innovation area from the government. Thank you very much, Dr. Yamanaka. Now, it seems like there's a question from the audience. This question, I'm sure, is aimed to Mr. Sakamaki. In order to make the medical system here in Japan sustainable, like US or from China, what kind of role does the foreign investment from those countries would play? Well, that's a very difficult question to answer. But before I get into that, thank you very much for giving me this opportunity today. Now, in that topic, innovation and the system, sustainability, it's two topics, innovation or sustainability of the system. So I think that this topic is a twofold question. Starting from innovation, like US or China, not only the foreign investment from those countries, but like Ms. Marukawa had mentioned earlier, I think that the private sector and also the public investment would be a must. And on top of that, we have to accept the foreign investment from, say, United States or China. On the other hand, when it comes to sustainability of the system, the public insurance system, likewise US or China, they have the hospital system, and maybe the Japanese system may have to be, in a way, providing the medicine for the sake of US or China way. But if that is to be extrapolated here to Japan, I don't think it's going to work. Because in Japan, we have a public medical universal system. Therefore, when it comes to US or China way of system, would not work here in the Japanese environment. It may have been a very vague way of answering to that question, but I hope this answered to the question earlier. Thank you very much. Now, next theme that I would like to talk to you would be as follows. primary care, secondary care, and there seems to be a comprehensive issue. This year we have the COVID-19 pandemic. And here I have a question to you, Dr. Yamanaka. Now, as a result from COVID-19, what has been the weakness of the healthcare system that has surfaced as a result from that? And as a result from this pandemic, is there anything in particular that you have, noticed something anew? Well, thank you. Now, regarding this COVID-19, I would say that this is one of the largest disaster that no one could have been able to predict. So talking about the healthcare system here in Japan, I think that the healthcare system itself was not developed anticipating this kind of a disease is to occur. But it wasn't. Therefore, the question arises as to how we would be able to tap into this kind of critical issue. And another thing that the citizens have noticed was that where to go to be diagnosed at COVID-19. I think this has been one of the largest voice that came from the citizen side. And when it comes to the primary care and secondary care issues, which has been one of the topic earlier, I think that the coverage of the two was something that was not clear in a way. Of course, if you think of the situations generally, there is a difference. However, in case of this new communicable disease comes into the picture, I think it was unclear as to what should be the primary care versus secondary care. And also the home doctor and also the secondary care difference. I think this has also shed light as well. Here in Japan, there are a lot of popular doctors, and I do know that there are a lot of doctors who specializes in various illnesses. And their information actually came about here and there in various medium. For example, if the person is diagnosed as a certain disease, for example, in that case, the patient would want to go see a doctor who specializes in that particular disease. We can do that here under Japanese system. So when it comes to the home doctor per se, I think that this is something that some people, the general public, did not know which doctor specializes in what when it comes to COVID-19. So what we need to do is that if the people has their own home doctors, I think it's important that these doctors should have a information so that the doctors would be able to diagnose or in some cases send their patient over to some other hospital that specializes in that particular disease. And that's something that I've come to notice. Well, thank you very much. Now, Ms. Marukawa, as a result from COVID-19, I also would like to ask you a question as well. Now, there is a medical system and the vulnerability there. And if you have any comments per se as to what you think would be needed, then that's be appreciated. Thank you. Now, first and foremost, in Japan, we do have a national coverage healthcare system. And I think that many people have recognized how great the system is, because looking at the communicable disease here in Japan, of course, that, this has to do with the personality of Japanese people, that they are always quite obedient on whatever doctors or government tells them to do. So in a way, they were quite obedient in taking necessary behaviors in order to prevent them from getting COVID-19. And also, people would be able to go visit whichever doctor that they can because of this national insurance system. And I think that this system actually played a great role under this COVID-19 because they can go to any doctors or hospitals. If each and every people had a home doctor per se, then that could have been much better. But because of the fact that there were no person who specializes in this kind of infectious diseases as to how to tackle this kind of disease when the patient comes. Therefore, that has been one of the blurry aspect of the primary care versus the secondary care. So this has been the learning that we had. And there's also a medical system that has been quite strong in Japan. And if the patient wanted to go to a certain doctor that he or she always go to, sometimes the doctor's office was closed and was not able to be diagnosed. So we need to have the second line way of where to go to. And another problem that we faced with is the data related to healthcare. The data was not necessarily captured by the national central data or amongst the doctors' groups as well. For example, where did so-and-so patient visited, and as a result, the person got infected and went to which hospital, for example. That kind of data was not captured altogether. There were no system for that. Therefore, we had to rely on paper, for example. The information came in from the doctor's offices on paper, faxed over to the health offices that are run by the government. So this has been one of the issue. But under Mr. Suga, the Japanese Prime Minister, I think that this would have to change. And he clearly had mentioned that, especially when it comes to the expansion of this kind of pandemic. It is quite important that such live data should be passed on to the R&D immediately. And I think we have come to notice that as a result from COVID-19 pandemic. Well, thank you very much for that. Now, I would like to ask Mr. Yamanaka. Now, I think that you have been in the forefront of this. In case of Japan, I think that Japan is providing patient-centric medicine. Do you think that's been the case? Or if there's any area that the system has to improve, then we're welcome to know. Thank you. Now, as Ms. Marukawa had mentioned, we do have the national health coverage here in Japan, meaning that anyone would be able to access to healthcare, which I think is great. And they have the freedom as to which hospital they want to go to. For example, this is so different from that of UK. Therefore, when it comes to the satisfaction level amongst the patients, I think it's quite high. Plus, when it comes to the expensive medicines, we do have the system for the year-end reimbursement if the patient pays for the full amount of those expensive medicines or systems. In that case, we do have such a subsidy for these patients, even if they pay for it. So in a way, our system is patient-centric. However, there's also a downside as a result from doing so. For example, if one patient, say it's an elder person, have multiple diseases, in that case, the person may have been visiting multiple clinics. And there could be a situation of polypharmacy, which could be of a risk at the end of the day. And financially, there would be some wasted expenditures as well if the person does so. So if there is a home doctor close by, who would be able to oversee the multiple medication that the person is taking, then the situation would have been better. But again, when it comes to the high-priced medicine reimbursements, sometimes this actually affects the cost effectiveness amongst the doctors and patients, because sometimes even if the medicine is very expensive, because of the reimbursement system we have here in Japan, people tend to prescribe that kind of a pricey medicine so easily, even by the doctors and by patients as well. So I think that this has to be rectified. Now, Mr. Sakamaki, can you also give me a few comments? I think the question has to do with, in order to move towards a sustainable system, what is the minimum required condition? Well, it seems like I'm getting all the difficult questions. No? Well, when it comes to a sustainable system, I would like to mention a few words related to that. So is it okay if I start from there? Now, when it comes to this system, there's always a budget required. And as was mentioned by Dr. Yamanaka, sometimes the person would not be able to access to an high-end medicine unless the person goes to a home doctor, according to the situation from other countries. But for example, in case of UK or other European countries, if the hospitals runs out of budget, sometimes the people would not be able to go see a doctor. So that could oftentimes occur. So if we were to discuss about sustainability, we have to discuss what kind of medical system is required for which patient. And I think that this kind of matching would have to be sustainable. And I think that is the healthcare sustainability we're talking about. So when it comes to sustainable medicine, and in order to achieve that, I think that the co-payment by the patient may have to be increased as well. Because one of the largest discussion that we have to do is the balance between the subsidy and the co-payment by the patients. And if we are to extend our discussion to that level, then I think it's going to become endless. But you see, when it comes to the medical expenditure by the government, I think it's important that we include that kind of topic as well when we talk about sustainability. Now, there are areas that can make it more effective and efficient. For example, biosimilars and some other new medicines as well. But right now it's about 43 trillion or so for the medical expenditure here in Japan. On the other hand, it's about 10 trillion or so for the expenditure on pharma, meaning 1/4 of that expenditure is spent on medicines. It is quite difficult to compare this apple to apple with other countries, but I think that our ratio is quite high. Plus, if we were to look at the growth rate in recent times, especially comparing it with OECD, biosimilar or generics or the use of that, I think is going to be quite important as well. But also the drug pricing is going to be another issue. How to control that drug pricing is another aspect that needs to be considered. That concludes my answer. Well, thank you very much for that. Now, Sakamaki-san, Mr. Sakamaki, you mentioned about the drug pricing, and therefore, we would like to now shift our gears to focus on the drug pricing. And again, I have another question to Dr. Sakamaki. Reducing cost, and can we really be able to improve such pricing aspect? Can you give us your comments to that? Well, both of them are quite important. I think that it is quite important as to how to do this all together, but I think it's a must that we have to do that. I am repeating this, but for example, generics or biosimilar, promoting both would be quite essential. And also when it comes to the new medicine, we consider this to be a long-term medicines that would have to be gone out from the market in order to give way to generics. And I think that there are a lot of innovations that has to come into this picture as well. When it comes to innovation, this is multifaceted. For example, people are now able to intake medicines better than it was before. But the innovation that will become essential would be something to do with the medicine that would cure a certain disease that is life-threatening. For that kind of the medicine, like Ms. Marukawa had mentioned, biologics, for example, is going to become quite important in this kind of a development. And many people say about the rooted innovation, meaning that for this kind of drug development, the root would have to be valued quite importantly. For example, for high pressure, or say some gastric tumors, we do already have a very good medicine to take care of that early stage. And oftentimes we talk about unmet needs, and there are some areas in which the unmet needs are still not met. So there are innovation in that area. And at the same time, there are some innovations that are from the met medicine area as well. So I think there has to be a contrast between the two, and to value this from a scientific perspective. So that, I think, would be the answer to your second question. How to promote this medicine, keeping in mind of the pricing aspect. Another topic to mention is how to improve the drug pricing review process. And I think this is quite a vital area. If you think of the drug pricing setting, I think amongst one of the developed countries, I think we do have a transparent system, but that transparency is not as transparent as it used to be. The basic consideration here is to keep the transparency and at the same time evaluate the current system. And I think that this is something that we have to consider on the current budget or national budget aspect. And this would have to be incorporated into the drug pricing review process, which is becoming quite urgent to be done. I hope that answered to your question. Now, I have a question to you, Ms. Marukawa. When it comes to a money for the comprehensive medicine and vis-a-vis the preventive medicine, can you give me your comments there as to how to differentiate the two? Now, before I get into that, I would like to dwell upon what Mr. Sakamaki had mentioned. That's quite important, actually, because when it comes to the drug pricing, this is very important. Although it's been done, it's not transparent to the public. In order to evaluate on the innovation, I think that this is going to drive the new budget to be allocated. So this is a genome area, because last year I actually started on focusing on the very topic, and that has started as a result from me proposing to the minister. Well, this genome is one of the areas that would be the basis, and I think that this is something that would become more and more personalized. On the other hand, in some cases, the medicine should be passed on to whoever in need of, and personalized medicine would enable for the person to match the medicine to their own needs. So the genome area and the personalized medicine is something that we would have to push it forward with. On the other hand, switch OTC is again would be quite important to minimize the medical expenditure. Because within the Ministry of Health, we are talking about putting a commission to be able to do that. And another thing is a comprehensive holistic medicine. Now, within the reimbursement system, we do have some scoring system, and also we do have the reimbursement in a daily basis. As of April 1, for the acute medicine, out of the beds, 89% of the beds are under that category. In the secondary care area, I think that we are becoming more and more advanced than it was before. However, when it comes to the primary medicine, I think that this is not necessarily being understood fully by the public either. It would be better off if the people can access to the medicine early enough and spend a necessary amount for that. And I think that this is something that we would have to discuss further as to how to make a very good balance between the two. Now, preventive medicine is also shedding light recently. It is one of the grand themes that we have to keep in mind. We are moving towards a super age society. Are we going to cover everything by insurance system, or are we going to optimize the medical expenditure? And that has been the question that we're trying to find the answers to. But the first and foremost importance is that the public has to be healthy at all times. So we're trying to promote increasing the healthy age by 2040, both men and women. Let's say there's end of life. We would want these people to be able to live their life autonomously, and we're trying to extend that kind of unhealthy year by 3 years from where we are today. So we're trying to give various incentives for the people to be able to do that. For example, we give the opportunity for those elder people to go take a health checkup free of charge. And those are the things that we're trying to enhance so that the public would become more and more aware of living healthy. And another aspect is the digital interviews. For example, we're trying to have the public to get the insurance cards so that they would be able to access to the digital prescription. So this is something that is going through the trial and error, having the collaboration from the various healthcare professionals so that the system would be in place for the public themselves to be able to have a better mind towards living healthy. So that's another thing that we would like to endorse and promote. Thank you for that comment. Now, when it comes to the government incentives, I would like to hear another comment from you, Dr. Yamanaka. Well, I think that this has to do with the introduction of the biosimilar introduction. I would assume that would be incentives for that. Is that right? Yes. Okay, when it comes to the biosimilars, those are deemed to be quite expensive, which would be burden on public, and that's already been well known. So there are some discussion as to better off to shift towards the biosimilars, and that's how the development is going on. For example, my specialization is rheumatism, and we do have a lot of biosimilars for that as well. I am more of a proactive person using biosimilars, because when it comes to the biosimilars, it's different from generics. It has been thoroughly done for the equivalency with the original drug, conducting clinical researches. Therefore, it is quite handy to use such biosimilars in the rheumatism. But even so, in the whole rheumatism area is concerned, the use of biosimilar is not growing. And I think there are multiple reasons why it's not taking off. One has to do with the reimbursement to the expensive medications. Because of the amount of the money that they spent would be reimbursed at the end of the year, there is no reason for them to go towards a cheaper medicine. Even if they are paying for the same amount of money, then they rather would like to go with whatever that they are familiar with, rather than switching to something new. And another thing is that even if we are to use the biosimilars, I think that the private companies, even if they talk about the biosimilars, people would become suspicious that the companies are saying that only for their own money making. And I also have talked about this in a different occasion, but I think that the Ministry of Health and Welfare should show their strong commitment wanting to switch to biosimilar. And I think that kind of a commitment would push this forward. And then for the incentives for the use of biosimilars, that actually had already started. However, to my eyes, the incentives is not as large. So the passion or the commitment of the ministry is not reflected to that incentives yet to date. In case of US or Europe, there are countries that have switched 100% to biosimilars. So that a drastic policy making, but I think that Japan should think of making more drastic than whatever that they're doing today. So that's my view. Thank you very much for that. Well, it is important to listen to your valuable voices, but now it's time, so we would like to conclude our panel discussion. And I think that when it comes to the healthcare system, the people were able to access to the healthcare with least amount of cost, thanks to the universal health coverage here in Japan. But I think that all your voices from different perspectives were quite valuable. And I'm hoping that this discussion would continue even beyond this webinar. Now, Ms. Marukawa, Dr. Sakamaki, and Dr. Yamanaka, once again, thank you all very much for sparing your very busy schedule. Well, thank you all very much. Now, the next session would be a closing discussion, so I would like all the audience to be with us. Now, this webinar talked about the innovation and sustainability in Japan's healthcare system, priorities for investment and reform. We are now approaching towards the end. I would like to now ask from the National Cancer Center, Dr. Yasushi Goto. Thank you for joining. Now, when it comes to the healthcare system and Japan priding on the high quality healthcare system, we have been discussing as to how Japan can improve. So for this closing session, I would like to ask you, Dr. Goto, who's at the forefront of this medicine, and explain to us on how you see the situation currently. Thank you very much. Now, when it comes to the innovation, if we look at where to invest, I think that there are resources, and I think that there has to be a basic knowledge that needs to come to place. For example, when it comes to infrastructures, there's always something of the basic science there. So you need to invest there in order to nurture the next level of innovation. On the other hand, investment per se is also quite difficult, because if there's an innovation, innovation is something that you cannot really choose, right? Something, it happens. In case of Japan, I think that the environment is somewhat difficult for the innovation to occur. And I think that there's also not much of an advantage to challenge on creating innovation. So if I were to ask to choose where to invest on, then I think the human resources would be the area. Thank you very much. Now, this year, globally, including Japan, we all faced with the COVID-19 pandemic. Now, from your view, Dr. Goto, I think you've seen the situations in hospitals of the COVID-19 situations. What are the weaknesses and strengths of Japan? Thank you. Now, people, well, I do not know who the audience is, but when it comes to COVID-19 pandemic, I think that the situation here in Japan versus US, Europe is quite different. If we compare data, in case of US and Europe, their situation is quite severe. In case of Japan, I think that the situation is quite different. But the pandemic itself is global, and therefore, of course, Japan is facing with the risk, and I'm sure there will be more risk to come. But this pandemic had occurred almost a year or so ago. But looking at the situation here in Japan, I think that this COVID-19 is something that are not close to panic. But then we're talking about the panic has come to Japan as well. And I think that this is not related to the healthcare alone. When it comes to the world of healthcare or medicine, we already do know that there are choices of treatments, and I'm hoping that this experience would be utilized for the betterment of the healthcare system going forward. I think that the infrastructure we have versus what the patient expects seems to be different currently. There seems to be a gap. So I do not know how that gap is going to surface after COVID pandemic. But during this COVID-19, I think that online use has promoted dramatically. And I think that people have realized that the infrastructure has to accommodate digital more so than ever. In this kind of a situation, sometimes it's very difficult to organize things to accept this kind of a transformation. And the hospital where I belong to is a cancer center. And I do not know whether use of so much money for the sake of simply building the infrastructure is wise or not. It's something that has to be looked at, because there might be more other areas that we want to invest in from a hospital's operations perspective. Thank you very much for that view. Now, lastly, when it comes to the healthcare system, especially from a sustainability standpoint, is there any challenges that we're faced with? Okay. Now, when it comes to the healthcare here in Japan, I think that the healthcare is positioned quite high here in Japan. It's quite high quality. I think we are blessed in a way, because regardless of money, we would be able to treat what's best for the patient. Sometimes the countries would not be able to do that. For example, Europe as well as in Asian countries, many of the doctors there would say that Japan is most blessed. When it comes to the United States, the handful of people might have an access there, but in case of Japan, all the people would be able to equally have the access to a high quality medicine, which is something we're blessed with. But one of the problem is that it doesn't have an autonomy, meaning that it's not profitable in a way, because many of the hospitals are not necessarily profitable, but trying to provide high quality care. So the question is, how could we be able to make impossible possible? So that's something we have to think really hard. Maybe the quality may have to be revisited, meaning that we should not over quality. I think that some of the medicine seems to be beyond what's needed. So we sometimes would have to revisit as to what would be the appropriate level of the care for the patient. But if the patient comes, we would provide what's best for the patient, regardless of money. But in each industry, we always have to think of profitability as well. But when we say for the sake of patient, then sometimes we would have to do whatever that's needed not thinking about the money aspect. Otherwise, it's not going to be sustainable. Thank you very much. Thank you for sparing your time. Now today, I would like to once again thank Pfizer for sponsoring this. And also, I would like to thank once again to all the speakers who had kindly accepted this offer. And on behalf of this webinar, I also would like to thank all the audience for staying with us. I've also mentioned at the outset, but I hope that this discussion that we just had would continue even beyond this online webinar. And I hope that discussion would become more and more fruitful. The content of this is going to become available online, so I would inform you once it's ready. So I would like you to share today's discussion with other people as well. And we also would like to send you the necessary information for this. And we would once again would like to send an questionnaire link as well. So we would like to have your responses to that, because we would like to utilize that for the betterment of the future webinars. So once again, thank you all very much.